to Eamon Gilmore.
Over the past couple of weeks, there has been a lot of debate and discussion in the country about the quality and adequacy of the cancer care services. And I think it's probably fair to say that public confidence in the country's cancer care services is now very low. Now, the solution that is being proposed or being suggested, I think, by virtually everybody who's discussing this issue, is this idea of centres of excellence. It's coming from the government and the HSE, and indeed I think all political parties are subscribed to the idea, and medical professionals seem to be subscribed to the idea. But I'm not clear as to what the government means by centres of excellence, and I'd just like the Taoiseach perhaps today to clarify a number of issues in relation to centres of excellence. First of all, how many are we talking about? Professor O'Higgins, when he did his first report, talked about 12. The Health Service Executive now seems to be talking about 8. The announcement that was made by the Health Service Executive in September stated that they identified 8 what they call designated cancer care centres. They didn't actually use the term centre of excellence, talked about cancer care centres. So is that the 8 that we're talking about? Are they going to be the 8 centres of excellence? And secondly, has the government approved those 8 centres of excellence? Thirdly, if that's the 8, what is the position regarding the North West? Minister of State Devons appears to be indicating that Sligo will be added to the list at some point. So can we get some clarification on what is the policy in relation to cancer care services in the North West, and will it be 9 rather than 8? Fourthly, in relation to the timescale, the Health Service Executive says that all cancer care services will be transferred to these 8 centres by the end of 2009. Where does that leave, or does it leave, cancer care services which are being provided in private facilities? Is it intended that they will continue separately, or that they will also be transferred to the centres of excellence? How will we know when we have a centre of excellence? Is there going to be some process by which there will be a statement saying that there is now a centre of cancer care excellence in Hospital X? Is there some formal process by which the centres of excellence will be announced or declared or opened, or whatever way it will be communicated to the public that there is in fact a centre of excellence? And finally, what is the budget? Mr. O'Brien, who is the chairman of the working group overseeing the plan, says that there are no costings or budget for its implementation, and that these haven't been worked out yet. And Professor Keane, who is the interim director of the cancer care programme, says that transitional investment will be needed over the next 2 years to bring it into to bring the centres of excellence into being. But there doesn't appear to be any budget identified for the centres of excellence. So what is the position regarding a budget for them, or how are they actually going to come into being?